Hi everyone, this is Mr. Neil Wright here, consultant audiologist and director of WAX. Thank you for joining me in another demonstration video of our recently developed WAXscope. We have a patient here who attended with a fully blocked left ear, and the earwax and dead keratin plugs extended all the way from the entrance of the ear, so it's quite lateral, all the way to their eardrum. Because this keratin and wax here, which is quite lateral, it was quite reflective. I just turned down the exposure slightly so we get less of a reflection. And I'm just using a standard Zollner suction probe to detach this plug and slowly manipulate it. You can see I'm making small circular motions. It's quite sticky consistency, the lateral plug, whereas the more medial plug, so the patient had two plugs, and you'll see I remove one at a time. This more outer plug was a bit more soft and mushy, so I'm just going to the top just to bring this down, trying to loosen it off the canal walls. And there we are, that's the first plug. So the WAXscope comes with 4 different speculi sizes. This is the 4.25mm. I suspect this is going to be the most commonly used one. Then we've got a 5mm for larger ear canals, a 5.75 for I would say more mastoid cavities, so it is abnormally large. And then we've got a 3.5mm smaller speculi for small pediatric narrow ear canals. So we've got the lateral plug out. This is the more medial one. This is a lot drier in consistency. You can see it's matted, there's a few hairs there. And I'm just going to get a suction grip, and we're just going to slowly but surely tease this out of the ear. When you've got a dry plug of wax like this, sometimes it can be difficult to get a suction grip. Also, the surface of the wax can be non-conducive to obtaining a suction grip. So sometimes you would use some olive oil spray there just to soften it, but managed to remove that. We just got a piece of dead skin and wax, a bit more lateral, it's on the posterior medial canal wall. So I'm just getting that in focus. And I'm just going to get a suction grip and just peel this away. You can see I'm lifting it up and away. The patient does suffer from superficial otitis externa, so they don't have any edema or hematoma of the ear canal, but there is quite a lot of dry skin there. It's a long-standing condition. That's the eardrum. Slightly opaque. You can see the blood vessels there supplying the hammer bone and the eardrum itself. They're the 2 plugs. The one on the left is the more softer one, and the one to the right is the firmer, more medial plug. I hope you enjoyed that video, guys, and if you are interested in the WAXscope, please do email info@clearwax.co.uk so we can add you to our mailing list. We should be launching early December 2022. Thank you.